Okay, this video is about the renal system part one. I'm not going to address every and each point as usual, just the major points. And I think that we make a mistake always disregarding the renal system as much as we should. The renal system is very complicated. It's influenced or highly influenced by hormones. But here's the thing, it's extremely important. It's one of the most important systems in the body. Yes, you can say every system needs to function, obviously, otherwise you can die. But when the renal system starts dysfunctioning, you start feeling it, um, so to speak, all over the place, and it's definitely going to influence the rest of the body. So the two major I guess, influences of the renal system are blood pressure through water retention, and obviously, water. We are a water environment uh, as a creation, and of course, the balance of salts and ions. So, when you mess with those two things, you get horrific trouble. So, just remember that. Um, I think that because it's so complicated, and you'll probably feel it going through the presentations, lots of chemistry, which naturally deters us, lots of hormones, each one contradicting, regulating, needs to be in balance with this and that. There's never one hormone that works alone. Kind of deters us from dealing with this system. And indeed, it's a system that is not dealt with a lot in exercise sciences. I can tell you that end stage renal failure patients uh, are some of the worst in the sense, not the people themselves. To deal with them as a clinician is extremely complicated. Extremely complicated. People on dialysis, it's hard to work with them from a professional standpoint in regards to the physiology part of things. The people are amazing and they deserve every help possible, but it's very, very complicated, and that's why people shy away from it. Um, and ask yourself, at this point, how much do you know about the renal system, or how confident are you with your knowledge about the renal system compared to, let's say, the cardiorespiratory or cardiovascular super systems? I'm guessing the answer is pretty clear and it's not in favor of the renal system. So let's go over renal function a bit, just a bit. You see on slide 13 the functions of the nephron, what it's capable of doing. I want you please to take a minute and read it slowly and not just see it as a short list of seven points. Look at what's going on here. Look at the processes and think how cardinal they are for survival. Okay, please stop. I'm begging you. Stop, read it again and again slowly, and ask what happens if this uh, stops functioning correctly, and how fast could it happen. So obviously, this is not um, something that you want to be injured or suffer pathologies, and unfortunately, we do. When we talk about filtration, we're talking about GFR, basically the glomerular filtration rate. What is your capacity of filtrating blood, urine, and so on and so forth? As all systems, you can see on slide 14 that we have both passive and active um, processes, and the final outcome, so to speak, is what you see in urine. So urine is basically the final destination of the system. It's the endpoint, which is outside of the body when you look at it as a lab test, obviously, and it's done. It's a done deal. So we look at urine in order to reverse engineer and understand what went on correctly or wrong with the renal system. In between, of course, there are organs and areas in the renal system that you can look at and identify problems. But once urine is established, produced, that's it. It's out of the body. It's done. Okay. Um, Obviously, there are substances that we cannot and do not want to lose uh, in great amounts. It doesn't mean that urine is perfect, but there's definitely normal amounts of different substances that we want and don't want to see in our urine. We want it to be as free as possible from proteins, electrolytes, and organic molecules as possible, clear as can be, but that's not usually the case. So I guess um, it's more reasonable, let's say it that way, to expect the loss of such substances to be within a normal range that is non-pathological and does not indicate a problem of function. Okay, as you know from our first chapters, topics, ions, electrolytes are important, and water are important for gradients. And once you change gradients, you change function as a fact. And when we talk about hydrostatic pressure, we're talking basically about the retention or lack of retention of water. And these are exactly the points where the renal system comes to play and influences the body to a great deal. And the forces, the balance between these pressures, as you remember, um, are the ones in the renal system as well that will establish and determine the pressures, the gradients, which is basically, if you think about it, the same words, and will uh, um, influence the uh, filtration pressure. The filtration pressure, or the net filtration pressure, meaning the difference between the two, is the force that you're left with to work with, the mechanical force that is actually at your disposal to filtrate fluids with. Um, so obviously, if you want fluids to enter the renal system or any part of it, you need the pressure to be lower where you want the fluids to go to than where they're coming from. Okay, so that's basically the bottom line of slide 18. A bit of anatomy there, and I expect you to brush up on the anatomy of the renal system if you don't remember it. Um, of course, the rate, by definition, is some kind of volume divided by some kind of indication of time. In this case, you can see that it's liters per day, meaning that the filtration rate is assessed or estimated or established per 24 hours. Then you see the values here. I do want you to remember the values if you don't mind. Um, Pretty simple to get, I think. It's a pretty simple um, ratio to calculate at your level of knowledge and experience. And then you can see that 99% is absorbed back, meaning that we're running through the system way more than we actually need. And that's a tendency of the body to do anyhow. We see that we circulate more oxygen than needed in the pulmonary system, and we circulate more blood than actually needed in the vascular system, and the same we're doing in the renal system. It's better to have more than what you need than less, or take the chance of having exactly what you need, right? So this is a safety mechanism. Um, what else? Of course, if you want to regulate filtration, all you need to do is regulate the flow of fluids, meaning vasoconstriction or dilation, and the same thing in any kind of pipe, so to speak, of the system. So any vessel in this case that carries fluids in it, you can play with the diameter, and by that regulate the system's functions. So that's what you see on slide 20. Obviously, if you have a low net filtration pressure, you're going to conserve fluids and vice versa. So that's the basic idea. Of course, at the end outcome, as indicated on slide 22, if you are producing too much urine or not enough urine, you are changing the pressures, and you can start going backwards and upwards, by the way, in the body, and noticing what changes are happening. But obviously, this mechanical part of the function of the system is cardinal. What else? Then we have transport, where we can start talking about absorption and transport is done more mechanically, chemically. I apologize, chemically, but it's influenced mechanically. And here the molecules and the hormones come into play. So you can see on slide 24 that ions, glucose, bicarbonate, amino acids, and uric acid are passively reabsorbed, meaning that they're small enough to deal with without the need to invest energy in when you're reabsorbing that. And then you see that, as we talked about in our first presentations and the initial ones, that if you want to actively transport something, you need proteins, you need transport molecules, and you need to invest energy. Of course, if you have 100 molecules, right, that can each carry one substance somewhere, and they're all saturated, then you've reached the maximum of your transport pathway or ability. So that's the part where we're talking about TM, or transport maximum, at the end. Beyond that, you are inefficient, or you are beyond the maximal efficiency that you can have. And then you can see, of course, on the next 2-3 slides, the idea of how this would influence substances in the body, function. Basically, we always want the system to be more capable than it's actually challenged for, even if you're inefficient. And the perfect situation is where you are just at your TM, utilizing everything that you have, but no more and no less, and that's maximal efficiency as well. You see different molecules that I expect you to know how they diffuse and in what ways. You see sodium here, and remember, where sodium goes, water follows. It's a very important principle to remember. So sodium is a quick and easy fix, so to speak, to regulate water movement. And with water, you're changing the mechanical gradient. It's the same idea again and again. It's basic ideas. Then, of course, you can use ions to use an electrical gradient to change concentrations and so on and so forth. What else? Now, one of the simple ideas is the idea of the reconstruction and breakdown of molecules playing with water and CO2. So you're going to see that a lot with the buffering of certain molecules that obviously is going to influence pH, and pH immediately influences function. What else? Let's see. Of course, you can influence the system from the outside, either by hormones or medications, right? What we call exogenous chemicals. Um, all the substances that the renal system deals with should be in balance. Yes, you can say that about anything. If you accumulate too much water in your body, you're going to drown yourself from the inside out. There's no doubt. But if you accumulate too much sodium, which is can happen way faster than water, or phosphate, or potassium, you're going to feel the differences very fast and very painfully. So obviously, any dysfunction, any imbalance that goes to having too much of one thing or not enough of the same thing, or the inability to buffer it, namely an imbalance, is going to cause problems and is going to cause pathologies, obviously. What else? You have a bit more of the anatomy of the system. You can see that the loops and the tubules, the distal tubules, in this case, and the collection ducts are the last resort, so to speak, the last location where you can fix something before urine is expelled from the body. It's the last place to correct places, and that means that it's a strategic place, location, an anatomical location that we need it in full function in order to prevent mistakes. What else? Obviously, the loop, its its size in general, which in this case, or the whole area, its size is dependent on the amount of loops that you have and their length. The more loops and the longer they are, the more chances you have to correct any mistakes and get urine concentrated at the right amounts and concentrations that you need. So basic ideas in the first presentation. I don't think there's much here that should really challenge you. Then you can see that the loops themselves have the ability to secrete hormones and substances to help them conduct their business. In addition, blood flow. Imagine that this is blood flowing, okay? There's two situations, you know, if you take it to a radical place. One, that blood flow is really slow. Now imagine I have something in my hand, okay, that you want. You're a cell in the body and you want what I have in my hand. You see it's in here somewhere. What are your options or your chances of getting it when my hand is moving this slow? Second radical situation, you still want what I have in my hand, okay, imagine it, but here's the rate of flow or movement. Boop. Once again, slow. What are your chances of grabbing what I have in my hand, right, compared to fast? Whoop. Obviously, in the first situation out of the two, it's easier. So you see that the efficiency and the ability to conduct the processes needed by the renal system are obviously higher when blood flow is low. Okay, that means that every particle of blood, every volume of blood stays in the area for more time, allowing you to extract or influence it for a greater amount of time. Hydrogen. Hydrogen by definition is the influencer of pH. Why? Because when you look at pH, what is pH? It's the P of H. H represents hydrogen. So obviously we are, in a way, a direct way, indicating the pH of a solution, sorry, by the amount of hydrogen in it. That's the difference between acids and bases, right? So obviously hydrogen has to be closely regulated and buffered when needed. So any molecules with hydrogen in it, which it would be hard to find one without, but especially those that tend to break down easily or be broken down easily, uh, are the essence to look at and take care of. And that's what you're going to see um, in the rest of the slides and presentations for the system. Then we obviously want to make sure that protein concentrations are low. High protein concentrations mean that we have a problem in two aspects. One, something is not working because we just said that we want them to be as low as possible. Two, you're missing proteins somewhere in the body that have a functional aspect. So that's a double whammer, so to speak. All right, now we can continue to talk about hormones. You know already a bit about it. You know that hormones are super substances with super biological powers, something to to take into consideration and respect. Uh, so you can see that when we talk about antidiuretic hormone, we're talking about the idea of preserving fluids because diuretics make you lose fluid. So antidiuretic hormone will increase blood pressure and vice versa. Remember, we're working with pairs with opposite influences on function. We can see that you're receiving, in this case, the distal tubules receive hypoosmotic urine, meaning under or very diluted urine, right, from the ascending limb of the loop. And the final concentration is controlled by a hormone that you've seen before and you've heard before about ADH. And it enhances water reabsorption. So if something is very diluted, it means that it has a high concentration or volume of water, fluids, for substance. In this case, we want to increase the concentration so we are reabsorbing water into the body. That's exactly what ADH does. And of course, if you have an imbalance of ADH, in this case, the lack of, you're going to have very diluted urine and you're going to be losing water that leads to dehydration and so on and so forth. Let's see. Then you see a very important point in slide 40 that ADH does not influence sodium reabsorption, meaning ADH cannot influence the body, the system, through sodium. That's not its mechanism. Then we have aldosterone. You can see that it's part of the RAS system that we've talked about before. You've heard about it. And it is the one that reabsorbs sodium, meaning we have two ways, main ways, to retain water. One, ADH, right? Though it does not affect sodium. And then we have aldosterone that does affect sodium itself. And where sodium goes, water follows. And I hope you shouted that out after me. Um, and then always the opposite of that would be the movement of potassium to another to the opposite direction, and in this case, hydrogen as well, meaning if you're absorbing sodium, you are secreting those two later substances. Now we can talk about the family of diuretics. We have ANP, BNP, and CNP. We have another one that we'll talk about in a second. These are very potent molecules. They are at the level or concentration, the size of 10 and minus 12. I've worked with BNP quite a lot in my life. It's really hard to work with um, in the lab because of its small units, um, but it's very, very potent. So ANP was found first, and you can see that it's in the vascular system more than anything else. I'll just say that the names, if you read the literature, start getting confusing for one reason. They actually influence multiple systems in the body, but their names are giving to them where they were first found and thought that they influence only that area before research proved that they influence multiple systems and organs. So ANP was found first in the vascular system, obviously. Um, and you can see that it influences obviously blood pressure through the changes in fluid concentration. You cannot tap into that without messing with the RAS system. That would be impossible. Um, and it basically inhibits the absorption of water through the kidneys, meaning that you're losing more water than gaining. Um, Obviously, if you're secreting water, if you're losing water, you're losing blood volume, okay, and pressure. And this, for example, is something that is part of the treatment in certain cases of people that have hypertension, elevated blood pressure. Um, so you have another section about diuretics. Obviously, you have to remember also that changes in fluids, volumes, and concentrations immediately tap into the basis of life, which is the ECF and the ICF. So remember that. That's not funny. That is literally tapping into the cell, and I'm pretty sure by now that you know what's coming. The cell rules. It's the smallest form of life in the body and in existence, and you don't mess with the cell, right? Okay, that one you can see in slide 48 that we start looking a bit more uh, particularly into renal hormones. You can see that we're talking about urodilate, which causes an increase in circulating blood volume and blood pressure, meaning it absorbs water or retains water. You can see that it uses sodium uh, as its main target uh, to do so. Um, let's see. It causes the loss of water, right? So don't get confused. If blood pressure is elevated, that means that in this case, we've changed the water balance. It's not balanced, it's not in homeostasis, and you're gonna see, in this case, uh, an increase in blood volume, meaning that you are inhibiting water reabsorption. Vitamin D. Obviously, we know vitamin D a bit more when it comes to the skin. Vitamin D has other roles to play in the body. Um, you can see that it's a regulator of calcium and phosphate, and it regulates their absorption into the body. Calcium and phosphate are cardinal to the function of the cell, of any cell almost. And when calcium is decreased, or plasma calcium is decreased, this the parathyroid hormone is secreted. Um, when this hormone is secreted, it attracts, it causes calcium to exit the bones, enter uh, um, the bloodstream, and that affects the synthesis or creation of a certain type of vitamin D. Erythropoietin, erythropoietin simulates bone marrow RBC production, which is very important to all the aspects of function. Obviously, the red blood cells influence the body through their carriage of hemoglobin and oxygen. Not only, but that's one of the main things that we as exercise professionals know and usually address. And of course, the number one influencer of that would be hypoxia. Um, and of course, any decrease in oxygen delivery to the kidneys will induce this process. Of course, if you lack the protein itself, then you are inducing anemia by definition, because now you don't have enough red blood cells to start with. But and you're going to go to a chronic condition of sort. Obviously, in this case, if we're talking about the renal system, we're talking about chronic renal failure, which leads, obviously, if you're talking about renal failure, failure of what? Failure to function. So you're talking about the lack of function of renal cells. Um, you can go over the renal function diagnosis. I'm not going to ask about that, but I think it's very good for you to know to understand the system. I promise you that treatment and diagnosis are not part of the exams, and I'll stand behind my word, but I think it's very good for you to know. Then we have creatinine. Creatinine is a very important substance. We usually think about it in the sense of metabolic pathways. It is a metabolite of creatine phosphate. It's a great way in the urine, by the way, to estimate active muscle mass at a ratio of 1 to 20. So every milligram of creatinine in your urine is give or take 20 kilograms of active muscle mass in your body. 20 kilograms is 44 pounds, just to use American units a bit more. But it also has a role to play in the renal system and its balance. And when you have a decline in GFR, you'll see changes in the bloodstream. So obviously we can tap into two places to understand what's going in the renal system that are indirect. Indirect. One is urine. We talked about it. The second one is the blood. You're going to see it on one of the two ends, if not in both. And as you know, when you tap into the blood and you change the blood tissue, you're going to change function not only for the renal system, but also for other systems. Usually, creatinine has a relatively stable production rate. I use the word stable here because that's what this book wrote, but I would say it's relatively stable. It's not constant 1 million of the time. But it's fairly constant. That's why it's a fairly good way to estimate active muscle mass, because skeletal muscles produce creatinine in a somewhat stable ratio. Um, so that's in regards to the content of slide 64. Then you see that even the changes, the delta, are very proportionate when you look at relative units such as percentage, as indicated once again in slide 64, to what's going on. So it's a it's a relatively easy and reliable substance to work with. Of course, the breakdown of muscle, the more you break down muscle, the more creatinine you're going to see in urine and in the bloodstream. And that's exactly one of the things that we see in advanced and pathological breakdown of muscle mass, aka rhabdomyolysis. Then we have urea nitrogen, or what we call BUN, blood urea nitrogen. It's a very good way of estimating GFR and urine concentration capacity, meaning the ability to produce urine, okay, UCC, because it's a very stable ratio and substance. So the more stable the substance is, the more constant the ratios that it's kept in, or the change is linear, the easier it is to establish or predict what's going to happen and reverse engineer and understand what has happened. So you can see that BUN and GFR have an inverse relationship, meaning when one goes up, the other goes down. Then you have the explanation. I think it's pretty simple to understand. And urea nitrogen in the blood changes immediately with the changes to protein metabolism, or catabolism to be more exact, what we call proteolysis. Then you have a bit of a joke there. Then you have the idea of urinalysis. Urinalysis is something relatively inexpensive. It's the idea of analyzing one's urine. And then all the jokes about this being the last slides are obvious from previous courses where this was the last topic. Not in your case yet. I didn't mean to be that cruel. It just came out that way. Okay, this is the end of part 1. We'll continue with part 2 in my next video. Stay tuned. Of course, if you have any questions, please shoot it my way. Thanks.